The thyroid is a butterfly-shaped endocrine gland located in the front of the neck, in front of the trachea. Its main function is to produce a series of hormones necessary to regulate metabolism, body temperature, heartbeat, and indirectly also breathing, as well as to ensure the growth and development of our body. However, when the thyroid does not function properly, a medical condition known as hypothyroidism may arise. As the prefix hypo suggests, the thyroid secretes an insufficient amount of thyroid hormones that do not allow it to properly perform all its functions. This deficit manifests itself with a series of different signs and symptoms, which are reflected in the health of the entire organism. But what are they? Let's go and see them. Cold intolerance. The thyroid plays a role for the body similar to that of a thermostat in the home, with the difference that we cannot regulate our body temperature to our liking, as the thyroid gland takes care of this independently. In hypothyroidism, this mechanism does not work properly, causing increased sensitivity to cold, not only during the winter, but also during the summer months. This happens because the reduced production of thyroid hormones, in particular triiodothyronine T3 and thyroxine T4, reduces energy consumption and therefore internal heat production. The body then activates a defense system to preserve the remaining heat and does so through what is called vasoconstriction. This is a narrowing of the diameter of the blood vessels due to the contraction of the smooth muscles in their walls. In this way, the body reduces the flow of blood to the extremities, such as hands and feet, and uses it mainly to supply the vital organs, thus limiting heat loss as much as possible. This explains why people with hypothyroidism often report having cold hands and feet, as well as a general feeling of coldness throughout their body. Bradycardia. The thyroid, and in particular its hormones, play a fundamental role in the cardiovascular system, as they have a significant impact on cardiac function, vascular resistance, blood pressure, and heart rate. In an adult at rest, the ideal heart rate, that is the number of beats the heart makes within a minute, is between 60 and 100. However, in the case of hypothyroidism, a decrease in the heart rate at rest may occur, generally below 60 beats per minute. In medicine, it is indicated with the term bradycardia and indicates an alteration of the heartbeat, where it is slower than normal. You may experience a feeling of fainting and shortness of breath, dizziness, weakness, and difficulty breathing. Hypothyroidism also causes a reduction in cardiac output, or the amount of blood ejected from a ventricle of the heart in 1 minute. This decrease is due to impaired relaxation of the smooth muscles of the blood vessels and reduced availability of endothelial nitric oxide, a potent vasodilator. This results in increased arterial stiffness, which in turn leads to an increase in systemic vascular resistance, or the resistance that the heart must overcome to pump blood through the circulatory system. Weight gain. Metabolism is the set of chemical reactions with which the body produces energy from the nutrients it receives through food. Thyroid hormones are in fact involved in the regulation of basal metabolism and thermogenesis, consequently playing an important role in the metabolism of lipids and glucose, in food intake, and in the oxidation of fats. In case of hypothyroidism, however, due to the reduced production of thyroid hormones, metabolic processes tend to slow down, thus reducing the body's ability to use available energy efficiently. This slowing of metabolism leads to a lower consumption of calories and therefore tends to facilitate weight accumulation. In most cases, however, weight gain in hypothyroid people is mainly due to water retention rather than fat accumulation. This is because an underactive thyroid gland negatively affects kidney function, causing a reduced ability to eliminate excess fluid from the body. In the case of hypothyroidism, thyroid dysfunction can also have significant repercussions on appetite and consequently on body weight. By slowing down the basal metabolism, many people may consequently experience a decrease in appetite. However, let's remember that both appetite and metabolism do not depend exclusively on the activity of the thyroid, but also on other factors such as gender, age, diet, physical activity, lifestyle, and medication intake. Chronic fatigue. A feeling of chronic fatigue and muscle weakness is frequently found in patients suffering from hypothyroidism. This symptom, although common to many pathologies, could be the warning bell of a thyroid dysfunction, including hypothyroidism. This is because the reduced production of thyroid hormones negatively affects protein synthesis and alters metabolism at the cellular level, compromising the ability of the nervous system and muscles to obtain the energy necessary for their proper functioning. All of this inevitably affects the daily life of the hypothyroid person, who, feeling always tired and weak, has difficulty carrying out normal activities. Not only that, this feeling of chronic tiredness does not tend to improve with rest because it is deeply rooted in the altered metabolic mechanisms associated with hypothyroidism. Other symptoms. Other symptoms of hypothyroidism include dry skin, stiffness, swelling or pain in the joints, but also excessive hair loss, thinning eyebrows, and brittle nails, which are more likely to break. An underactive thyroid can also negatively affect bowel function, as it slows down bowel movements, thus promoting constipation. In the case of women, hypothyroidism can also cause alterations in the menstrual cycle, and generally they tend to present prolonged and heavy menstruation, sometimes accompanied by anemia, as the excessive blood loss lowers the levels of iron in the blood. This is called menorrhagia and is often associated with dysmenorrhea, a medical condition in which menstruation occurs together with a series of symptoms that can be highly debilitating. Among these, we find uterine pain, abdominal cramps, headaches, and low back pain. In conclusion, we have seen how the thyroid, with its hormones, influences the functioning of a good part of the body. However, when it does not work properly, as in the case of hypothyroidism, some of the symptoms described in this video may appear. At this point, it is important to contact your doctor or a specialist in order to undergo the necessary tests to ascertain or exclude a thyroid pathology. The diagnosis is based on an objective examination and a simple blood test that allows you to measure the levels of thyroid hormones, T3 and T4, and TSH, the pituitary hormone.